Welcome back, everyone, to the Veritas Health Group podcast. I'm here with Dr. Latchin Hatemi, owner and physician of 2 locations now for Veritas Health Group. Our first location is right down the road in Lexington. The second location is downtown on Assembly Street.
Assembly, yes.
Yeah, so if you're in the USC downtown Columbia area, there's never really much of a wait at the downtown clinic. So go check it out. But today we have a really interesting topic, and I'm going to let Dr. Hatemi introduce it. So what are we talking about today?
So we're going to talk about a clinic very close to my clinic in Lexington. It's called Veritas Health. Veritas Health is a clinic, primary care clinic that takes care of the county employees. So if you work for Lexington County, you are qualified to go be seen in this clinic.
So that's probably why I've never heard of it before.
You will never heard about it. There's no signage. So if you go to their building, you will never see a sign that says Veritas Health. They're kind of hidden away from everybody and public eye. And so hard to find.
So who does Veritas Health service then if I can't go there?
It's for Lexington County employees. So you're an employee of the county, you can go there. You need to make an appointment, so they're not like an urgent care. You cannot walk in. You need to make an appointment, and they're open Monday to Friday. And they have a 1-hour lunch break, so they're closed during the lunch. So it's more of a during business hours kind of a setup.
Okay, so if I'm like a teacher, for example, in the county, I could just go if I'm feeling ill, if I made an appointment.
Yes, you can. You need to make an appointment. They don't have any x-ray, so if you need any imaging, they will send you out. And for blood work, they don't do it in-house neither. They will send that one out too.
So how much would it cost me?
Well, it's free for employees, but the county pays for it. County pays around $1.5 million a year.
Wait, did you say $1.5 million?
Yes, $1.5 million, and it's
How
quite a bit.
How busy are they? Are they as busy as
Not
Veritas?
really, not really. I mean, they probably see, if they're lucky, they see like 20 patients a day. We see 50.
I don't see the math. How does this add up?
It doesn't add up. For the county to spend that kind of money, I don't think they're getting what they deserve. And what upsets me is this all started about 10, 12 years ago.
Okay, so you think that's when they opened?
Yeah, they opened 10, 12 years ago. They don't pay rent, so the county gives them free real estate. County even pays for their equipment, so they didn't have enough. They didn't have to spend money to build up the clinic.
Wow.
So it's kind of a freebie. And it started, I'm sure, with good intentions. The initial budget was like $700,000 or something close to that number. And this was 10 years ago. They got a 3-year contract. They won a bid. Veritas Health is a big company. It's a conglomerate. They won a bid for 3 years. And something happened in the end of the 3-year contract. Magically, they didn't have to bid again. They have been somewhat renewed every year since then for almost 7 to 8 years. Every year they renew year after year, year after year. And the number keep going up. Last number was $1.5 million. So it almost doubled in cost to the county, which is taxpayers' money, because county is supported by taxpayers. And you will think that government will put it out for a bid because it's taxpayers' money, but no, somehow it goes to this one company without any accountability or accounting. So I want to bring attention to this setup, which I don't think is fair, and I don't think the county employees are getting the best health care in return for $1.5 million is being spent.
Yeah, it sounds like there's really something missing here. What do you think it is? Who owns Veritas Health? Is it an individual or a corporation?
Veritas Health is a corporation. I think they're based in Indiana, actually. Okay. They're out-of-state corporation. They do a lot of employee health for companies or counties.
Okay, so this is something that they're familiar with.
Yes, that's what they do. My idea was that we are not getting what we spend the money for. I think we are getting cheated. The money we spend for $1.5 million, we can get way better healthcare, way better services.
Yeah, why not have imaging and labs on
site? Yeah, we should have imaging and labs on site, and it should have extended hours, maybe open on the weekends. So if you're a county employee and you get injured at work, you can come to the clinic too.
Or you could go during your lunch break?
And lunch break, which is closed. Marathon Health is closed during lunch break, so that's not even an option. I find the setup a little bit suspicious and concerning. I don't want to blame it on people. I don't want to point fingers. I talked with the ex-employees of the county. I don't want to give their name here. I might call them out in the future, but I think they are responsible for bringing this company on board. I asked them some questions, and I didn't get very clear answers to it. And I asked them, why we give this company $1.5 million without any accountability? And they said, well, we can. And there's a significant disagreement between me and the ex-county employee I talked to that he couldn't explain, couldn't explain why we are giving this company such a lucrative contract with very limited hours. The number of visits, the number of patients they treat doesn't justify the money we spend. And I think county should spend our money more wisely. As a taxpayer, I pay significant amount of tax to the county, and I will hold them accountable how they spend the money I gave them. And every citizen of Lexington County should hold them accountable. So I'm calling out to the county, Mr. Hudson, Beth Carrick, please explain to us why we are spending $1.5 million on this company without bidding. I hope you have a good explanation. I emailed them. I didn't get a response back, so I'm going to email them again, and I'm going to call them out publicly on this podcast that please tell us why on earth we spent $1.5 million on that contract, and who's getting any benefit from this. I think our county employees deserve better. I mean, this clinic is only in Lexington, town of Lexington, and Lexington County is a very big area. You have West Columbia, you have Batesburg, Leesville, you have Red Bank. I think they should have access to multiple locations, not just one location. Also, we should have x-ray, if they broke an arm or broke a bone or they need a chest x-ray, we should have access to that.
Yes.
And we should have extended hours. We should be having people should be able to come after work or during their lunch break or the weekend. I think that's important.
I think that those things could happen, or I feel that they could happen at the same cost, correct?
Same cost, maybe even cheaper. I mean, $1.5 million goes a long way. And I think we are not providing the services. And I don't think a lot of county employees are using this service, to be honest.
You think it's 20 patients a day?
20 patients a day.
Times 5 is 100, times 4 is 400, times 12 is 4,800. So then we would do 1.5 million divided by 4,800. That's $312 per visit.
It's $300 per visit.
And how much is it to visit Veritas?
$125.
There you go.
So do the math. They are getting a little bit gypped. And I think county employees will like to use different services. I would love to have that contract. I'm not saying give it to me. I think it should be open up for bid, and I should be able to bid on it myself too.
There should be an opportunity for other providers and physicians to at least take a look at it, at least have a conversation. I
mean, we need to have more transparent about that $1.5 million contract. I mean, what are we spending money on? Why we keep paying more and more? I mean, it started at 700, now it's 1.5, and the cost is not limited to 1.5 million. We provide them free real estate. That's probably worth $60,000-$70,000 a year. Whenever they need the equipment, I mean, they don't even pay it out of that 1.5. The county pays for their equipment.
How much would you say you spend on equipment per year, approximately?
I mean, $20,000-$30,000, and county a lot of money, and county pays for it. I don't know why. If they need a new computer or a piece of medical equipment, the county pays for it, which is ridiculous because you're already paying them $1.5 million. You would think they will at least have decency to pay for their medical equipment, but no. County puts them in their budget and pays for it. And if they need a paint job or they need any repairs on the property, county pays for that maintenance too. So I just want to bring more accountability to our county. I think I would love the county council to answer to this video in writing or publicly, I would appreciate that why Marathon Health able to get away with this contract without any bidding, and why everybody else needs to bid on contracts, but Marathon Health an exclusivity, an exception to that rule. I think there might be some legal issues surrounding that. I think it might be illegal to give a contract out without bidding with taxpayers' money. So I want to bring more accountability.
Is it the town council that handles that situation?
Not the town council, county, Lexington County.
The county council.
Town council have nothing to do with this. It's the county. So it is the Hudson and Beth Carrick and other members of the Lexington County, which is the bigger entity. You know, I think they are the one who should answer this question. And this is their opportunity to give it. And I'm I'm a loud mouth. I keep bringing it up more and more, and I want to give them opportunity. And if that doesn't happen, if I don't get an answer, I'll probably escalate, start giving press releases and all that things.
Yeah, I think, how long have you been in Lexington County now?
I've been here almost 5-6 years.
Yeah, so I think it's time for the county to give you an opportunity.
I think opportunity should be out there for any company, not just me. Any company to come give
for a bid.
For a bid, and we have the opportunity here. We have an opportunity to transform the healthcare for the county employees. Mm-hmm. I think that's huge. The cost of healthcare is tremendous for the county. County is self-insured. That means they bear the burden of the insurance themselves. I think we would be better option that we use some other company other than Marathon Health that's not equipped to handle a lot of these things.
I think it would be great for us maybe to speak with a county employee who visited there, just to see what it's like, to see how they feel.
So learn about their experience. Yes. They cannot walk in if they have a cut or they need stitches. That's not a place to go. You need to make an appointment a couple of days in advance to be seen, and that's not able to handle acute injuries.
I'd like to know what wait times are like, and what their experience is like inside as well.
I would like to know. And I live in this town, and I didn't hear about this company until a couple of years back because there's no advertisement, there's no signage. I mean, you go to their building, believe it or not, you don't know it's a clinic. I tell people a lot about it, even county employees, and they had no clue what I'm talking about. So it's kind of concerning, why a clinic doesn't even have a signage. How are you supposed to find it? How are you supposed to know about it? And why they're closed during lunch break? I mean, the patients, that's a very convenient time, a lot of employees to come during lunch break, and you're shutting it down. I find that little concerning. I think we should hold them accountable. I think this video will be one of many videos. We're going to talk about this. I'm going to make an episode in front of their building one day too. And so you guys know which place I'm talking about. It's behind Lizard's Ticket in Lexington, town of Lexington. Walking distance to my clinic itself. So I would like to know what it is. And I would like to know because... when this first happened, one of the county employees at that time, Joe Murgo, actually went to the, I believe, Vermont, to talk on behalf of this company, and almost acting like their spokesman, saying how great this company is and how good it does for the employees and I kind of find it concerning because a county employee, he doesn't work with the county anymore, but going all the way to Vermont to speak on behalf of this company kind of make me concerning, and this company is, we need to look into the services. We need to have a breakdown of per visit cost and how much money we are spending, and if there are cheaper alternatives or even better alternatives. And I want to bring this opportunity to know people to know about it. Marathon Health. You never heard about it, right?
Not at all. Not until today.
Now, a lot of county employees don't know about it neither. So look into it. I promise you, what you're going to see will be very interesting when you look under the hood of Marathon Health.
Lexington County, Marathon Health, we're calling you out.
Yep. Do better, guys. We are watching.
We would love to have someone from the county come talk about this issue. We would love to have someone from Marathon Health come talk about this issue.
So we would love to give it an opportunity. Yeah, I don't want this to be a one-way conversation. I would love you guys to have it on my podcast. I would love to know about why we spend $1.5 million. Anybody from the county, Lexington County, can come to join our podcast. I'll be more than happy to talk with the councilman in the county council, and would love to know about their input.
Open invitation for anyone involved to come discuss this issue.
Yes, and I would not want to call out names, but you know who you are, and we are here waiting for you to give us some answers.
All right, that's a wrap. If you guys are looking for more information, check out veritashealthgroup.com. Make sure to follow the podcast on Facebook, YouTube, Instagram, iTunes, and Spotify. Dr. Hatemi, thanks so much.
Thank you. Thanks for having me.
Yeah, we'll see you guys on the next episode.
See you guys.